Hall. We are going to be recording our town hall. It will be available afterwards if you want to view it again, or look at some specific clips, or share it with some of your other clinic members that will be available afterwards. So, getting started here, we've got a good agenda today. We are going to be talking about a lot of book things. We're going to be diving into tracking the number of books distributed. We've got some tips and tricks, and we'd also love to hear from our community here on how you are tracking your books successfully. And then we are also going to be hearing from two of our partners, Barefoot Books, who we are thrilled is officially a Reach Out and Read approved publisher. And so we are going to get to hear from Sarah and Nancy a little bit later about ordering with them. And then we're also going to hear from Lakeshore Learning, which has some fantastic waiting room kits that they are unveiling for us. And they will be diving into opportunities there. But before we start with all of that content, we are going to start by welcoming some new team members and a couple updates. So I'm going to pass it over right now to our two new team members. We have Lana joining us. I'll have Lana jump in and introduce herself.
Hi, everyone. It's nice to see you here. Thanks for coming. I've been really lucky to meet some of you in person at site visits, but I'm one of our new program coordinators, um, and I'm based in Brooklyn. So seeing a lot of you in Brooklyn, but also Manhattan, Queens, and the Bronx. I'm excited to be here. I'll pass it to Shreeja.
Hi everyone, so nice to see everyone here. My name is Srija and I'm also one of the new program coordinators. Very excited that I've also gotten to see some of you in person and will be seeing some of you very soon. But yeah, I'm currently based in the Upper West Side, but I love traveling to all of the sites and seeing the clinics in person. So very excited.
And we're thrilled to welcome both Lana and Shrija to our program team. You are going to be hearing all about them, all from them on progress reports, on site visits, questions you have. Lana and Shrija are also available to help with all of those supports. So thrilled to have them join us and thrilled to give them a big welcome. The other staff member that I wanted to mention is we have a part-time outreach coordinator who's also joined us, Bryce DiMatteo. And so she is working part-time with us mostly on Mondays, but she's also going to be available for any questions. This will be mostly for new sites that are onboarding and for some different outreach opportunities. And so if you see her at different meetings, then we will also be able to welcome her as our new part-time outreach coordinator. All right, jumping back into our PowerPoint then, we're going to go over some updates. Jesse, take us away.
Thank you so much, Gary. Good afternoon, everyone. I'm very happy to be here with you all for our town hall for quarter 3. So some updates to share before we get started. If you're having trouble logging into my ROR, make sure that you contact your IT team and letting them know to put them in the firewall safe list. If you encounter any access issues, we notice a couple of those when submission with progress reports. So it's just giving you a heads up. Updates for this progress report cycle, which we're concluding. There was a revision to question 11, aligning to our site quality review, question 14, which you will see when we're on the field for site visits. And you see an update in my ROR for asking for credential completion. This update is coming from National, and we are requesting to make sure that all of the contacts are updated in my ROR with credentials so that they can discern who to send the training to. And as a reminder, of course, progress reports are essential for us to capture site level data, demonstrating impact, inform fund needs, and most importantly, identify what areas of support our sites need. They are required twice a year. So once again, we're concluding the cycle. Progress reports will be opening again on July 15 of this year for the second progress report of the year. And we'll be sharing any trends for the past progress report in the upcoming weeks. If you have not heard, if you have not had your site visit yet for fiscal year 26, you should be hearing from Lana, Shreya, or myself. So please be in the lookout. And if you're ready to schedule the visit, please contact us. We are happy to see you in person to schedule that site visit. Last but not least, please save the day for our annual virtual conference on May 15. I'll be sharing the links in the chat, as well as our award ceremony and resource fair on June 3rd, which will be an in-person event at the Deloitte offices. Thank you so much, Carrie, and passing it back to you.
Thanks, Jesse. Yeah, and once again, our conference and research fair are free to everyone, so we're excited to be able to offer that, and looking forward to seeing people virtually and then in person. The one update that I wanted to share is regarding books. So, you received a survey from Shrija a couple weeks ago about our next book order with All About Books, and those books are set to be delivered in May or the August, September, depending on what you selected. If you did not fill out that survey, don't worry, you will still be getting books. You'll be getting them in May. So that is the book status for everything for this year. And then moving forward, we're going to dive into some book tracking things. So, definitely during this part of our session here, I welcome any thoughts, questions. Feel free to raise your hand or put things in the chat. We're really looking to have a conversation, discussion, and then also provide some best practices from the sites, as well as some resources that Reach Out and Read has for as accurately as possible, tracking the number of books that are distributed. So, as you know, book tracking is one of the main questions that we ask on the progress reports every 6 months. How many books have you distributed for that 6 months to 5-year-old age range? And the accurate tracking of these books are really important to the success of the program so that we really understand how many books the clinics give out to families, what is our book distribution rate, are all of the well visits that come through the office able to receive books? Are we not sending enough books? So things like that are going to be really important when we're looking at the book distribution for our sites. So I've got a quick survey that I'm going to launch that just asks a couple questions about your own book tracking processes and how you are currently tracking books. And then also, how confident are you in your tracking system and how confident are you in its accuracy? Feel free to answer. It's anonymous, so answer however you would like. Um, Question one, how are you currently tracking books? The electronic medical records, tally sheets. We've seen sticker systems, color coding bookmarks, or if there's other methods that you're using. And then second question again, how confident are you? Are you super confident, ready to say that this is the gold standard? Um, Most of the time it's pretty good. You're confident, it's accurate. Um, System's not working well, or help, we need a better system. I'll leave it open for another little while. All right. This is great. I'm still seeing a couple results roll in, so I'll open it for another 10 seconds. All right. Ending the poll, and let's share the results. Let's see. So the majority of people on the call here are using their electronic medical records to track the number of books that are distributed. We've got about 25% that are using a tally sheet. None here are talking about the sticker system, color coding bookmarks, and then we have about 9% with other methods. Um, I'm loving this confidence. Look at this. Quite confident that we have a great system to use, or pretty confident that we have a really good system to use. And for those that are not confident or kind of help throwing up the alarm bells, no problem. You're in the right place. Let's talk about it. Let's figure out what we can do. All right, so I'm going to go through some of the three main areas that we've seen, three main strategies that we've seen with tracking books. And that first one is going to be the electronic medical record, which is one of those that we recommend. So we'll go through these over here, the electronic medical record system, the tally sheets, using stickers and using that, whoops, color coding and bookmarking system are all strategies that we've seen really successful, work well, and be accurate in tracking the number of books. Two of the areas that we would not recommend is waiting until the progress report is due to count the books, and then also using your inventory as like that count for how many books have been distributed. And the reason we don't recommend, counting a pre and post inventory is that it doesn't necessarily track the medical professional interacting with that book and actually doing that distribution. Whereas the EMR system, the tally sheets, the stickers, the bookmarks all require someone, medical professional, to have the books, to hold it, and to then mark out that they are distributing that book. And so that's why that type of system is not recommended, whereas the other options we have here are recommended. And we'll dive into some of these. And also, again, if you have one of these systems that's working really well for you, keep it in the back of your mind. I'm going to ask for some volunteers to share a little bit about their system. So we would love to hear from you. And let's jump into the EMR system. So sites with the ability to do this can really edit their well visit template and choose to integrate Reach Out and Read into their tracking system. This often requires help of clinic managers, IT department to integrate it into your system, unless your medical system already has it as an option, which some of them will and do. And we've seen this mostly through either using that smart phrase or checkbox that's built into the well visits under orders, or using that like dot phrase in notes. And I've got a couple examples coming up next there as to how this has been integrated. Um, We've also seen that this is really successful in the reporting time, where as you don't have to count anything up, you can just pull the report from the EMR system and determine the number of books that are given every 6 months as you're asked for that progress report from Reach Out and Read. And of course, any EMR system tracking really needs that clear communication and training for providers to understand the correct way to log that. It's great to have the system integrated into the EMR, but if they don't know how to use it or they're not consistently using it, then it's not an accurate tracking system. Um, is anyone here using an EMR system that uses either the dot phrase or the order sheet that they want to come off mute and share a little bit about how that works for them? Where's my hand? See, I can't see people. Screen. Well, let's look into some examples first, but if anyone would like to jump in, please do, or put something in the chat if you'd rather do that too. Here's an example that's on Reach Out and Read on our toolkit on my ROR as an example as to how this looks in some medical systems. I believe this is Epic. Under orders, they have a checkbox for Reach Out and Read in English. And so this is how they check that to track how many books have been distributed in English there. We also have one example. I think this is from Health and Hospitals. So shout out to them for sharing some information here with us about how they use the dot phrase and or putting it under the anticipatory guidance section. And they have separated their tracking into also showing that a book was given, but also that counseling was modeled. So if by chance there doesn't happen that you don't have a book to give out, you can still mark that the anticipatory modeling was provided and the counseling was provided there. Um, another example, and I believe this is also in Epic. We have seen this successfully used, though, in eClinicalWorks, which I think is the other main EMR system for sites in the greater area, as well as other systems. We've seen this be successful as well.
Hi, Kari. I I had to step away and take a call, and I caught the tail end of your question. It's Carlotta from Health and Hospitals. So, yeah, this is an example of how we're able to pull this data, but we also provide our sites with dashboards so that they can see in monthly how well they're doing with big book distribution. They can also track and see what providers are doing it electronically, and they're able then to do a little coaching and making sure that this is occurring. So it's been really helpful for us.
Thank you so much, Carlotta. That's great. And yeah, much appreciated the attention and the opportunities to lift up the what's happening at the site level, and what their record keeping looks like.
If I could just add,
Yes.
off of Carlotta's comment, we've actually used this as a quality improvement process for our providers. So we're trying to teach the residents, medical students and residents, but we also want to teach our providers that some people are doing it better than others. And in the same way we're treating asthma, we want to get them to improve their documentation because we think this is so important. So I just want to throw that out there, but I couldn't do that without Carlotta. So.
Thank you, Dr. Siegel. Absolutely. Strong team. So this definitely is kind of our gold standard. The EMR system is easier than the other examples I'm going to go into, the tally sheets and the color coding system. So if this is at all possible, this is a conversation we would love to have with sites. And if we're finding challenges, we're also happy to connect you with other sites that have already integrated this, that can kind of walk through IT, what this looks like, and also can walk through, like Carlotta said, some different steps and opportunities that she's implemented to make sure that people are consistently using this as a solid tracking method. So other definitely recommended and still very accurate tracking systems that we've seen work successfully are these book tally sheets. We've seen where the tally sheet is kept where the books are stored, whether it's in a separate closet or in the actual exam room space, and with a writing utensil nearby. Every time a book is provided, the provider or staff mark the tally sheet in the appropriate way to mark a book distributed. And then at the end of a time period, whether it's a week or a month, those tally sheets are gathered and counted up together. And then during the 6-month progress report, when that is due, then you can look at the tally sheets from the past and add up and account for all the books that have been distributed. There are a lot of examples of tally sheets. This is one we've seen most successful. It has lines for the date given, the provider initials, and then a check mark for the age range of the book distributed. We also have some more examples here. Um, Again, these are more like tally sheets or stars or checks where you would check off the age range the book is distributed, the month or year. And then the one with all these numbers, you could use like a marker or highlighter to kind of mark off each number as a book is distributed, so that you know and can count them up at the end. Do we have anyone that uses a tally sheet really successfully that wants to jump in and speak a little bit about how that works in their clinic?
Hi, this is Amanda from Montefiore NICU. How are you?
Hi, Amanda. Great to hear from you.
Hi. So we do use a tracking system for us. It's really successful in the newborn nursery because we distribute books upon discharge. So a baby stays about 2 days. We just print out a label with the medical record number, date of birth, name, date given, and that's how we've been tallying it. It's really simple, really easy, and the provider is on the label as well, so they'll get credit for the distribution.
Oh, great. And then when you say label, are they like the sticker labels?
Yes.
Oh, that's great. Yes, I didn't have a slide for that one, but I put that one on my recommended there that yeah, printing out those labels and then having an extra sticker to put it on your sheets.
Yeah.
And then that it's a great way to track everything. And again, a way that's already sounds like it's integrated in your discharge process. So
hmm
um, great example. Thank you for sharing.
Thank you.
All right, I'm going to move on to our final recommended tracking method. And this is a color-coded bookmark system. And I think Lana was at a site visit recently where a site was using this successfully. But you can see in the photo there are bookmarks in each of the books that are distributed. Some sites have color coded these so that you know which month or which well visit you are taking that book for. And then once a provider takes that book, they can then take the bookmark out and put it in a pocket or a slip or a folder somewhere nearby where at the end of a week or a month, depending on what makes sense for your site, the coordinator, reach out and read coordinator can come, count these slips, and then note how many books have been distributed during that time period. Um, Again, really successful and is an example where the provider is taking the book and then showing that they have distributed that book through a tactile system there. And then, of course, this would require a little bit extra work where the slips are then inserted into the books when you're restocking the area. So there is a little bit of work on the front end. But again, we've seen this work really successfully for sites. Anyone on that has the color-coded bookmark system that wants to jump in?
This is Cooper from Urban Health Plan. How is everyone doing? We have a color-coded bucket system. So our buckets go by age range. So we follow like a rainbow bucket system, and so that the providers have an easier way of introducing the book to the patients.
That's great. Thank you so much. Yeah, a really solid system as well. Great. All right. Well, I'll go over again. Those are three solid systems that we've seen work successfully. If you have another system that you found that works really well, please let us know. We'd love to be able to share it with the rest of the group. And I'll just go over a couple best practices that we have here at the end. Um, but again, like that tracking system where the medical professional is acknowledging the distribution is what that we would recommend. And again, that consistency can sometimes be a challenge in that you have it all set up, you have a tally sheet, or you have it in the EMR system, but not all providers are using it or aware or know how to click. So we also would recommend, regular reminders, whether it's during morning meetings or weekly meetings, just to remind folks about what their opportunities are, what they should be doing to track books. We've also seen people put little reminders on their computers or monitors that just says, make sure you mark the reach out and read book, just as that other visual reminder to do that during their very busy days. We also will send out all of those tally sheets and some of the recommendations in a follow-up email to everyone on the town hall. But all of those tally sheets, as well as the some of the EMR recommendations, are available on my ROR in the resource library. So feel free to go in there and check out the other resources that are available, but we'll also send them out in a follow-up email. We would also recommend connecting with others at your clinic for support on any of these systems that you have going or that you would like to start, including the tech department, any coordinators, physicians, figuring out what really would work best for your site. We also absolutely are happy to connect you with other sites who can share their process that are doing a great job integrating with eClinicalWorks or something more technical. We're happy to make those connections. And then also feel free to connect with me, Jesse, Lana, Shrija, anyone at Reach Out and Read of Greater New York, we're happy to help make those connections or provide supports for your tracking systems. And that's what our last slide is here for connecting with us. All right. I am going to then, if you have any other questions, feel free to follow up with us. Happy to, again, provide additional, answer questions or provide additional support. Right now, though, I am going to pass it over to our friends at Barefoot Books. Sarah O'Neill and Nancy Traversy are here, and I will stop sharing my screen and allow Sarah to share hers.
Thanks, Carrie. Hey, everybody. I'm going to share my screen and in the meantime, ask Nancy to say hello.
Uh, Hello, everyone. My name's Nancy Traversy. I am the CEO and co-founder of Barefoot Books. We started Barefoot about 34 years ago. When I started it when my eldest daughter was 3 weeks old. She's now turning 34, so I know how old my daughter is and my company. But we are absolutely thrilled to be part of Reach Out and Read. It's just been a real adventure so far. We're just excited to meet all these new faces today. And I'm going to hand over to Sarah, who's going to tell you a little bit more about our books and our story and our systems and all those things.
Yeah, thanks, Nancy. And yes, we're both so happy to be here. And thank you so much for the invitation, Carrie. It's nice to see some familiar faces on the call. I think I met some of you at the summit in last fall. And hey, happy Friday, happy spring, first day of spring. This is great. Um, I think a lot of you know Barefoot Books already. I'm not going to spend too much time on our background because I really want to dig in and walk you through a couple of our the innovations that we've created for you all. As Nancy mentioned, we are so thrilled to be an approved vendor for Reach Out and Read. And just quickly, we strive to create better books to bring about a brighter world. We've been doing this for well over 30 years, as Nancy mentioned, and we got our start way back in 1992 in England. We landed in the States in the early aughts because Nancy is homesick. She's actually Canadian and she needed to be closer to home. But anyway, and between 92, 98, all the way up to 2026, we have continued to innovate and find spaces, find our people, be involved in our community. We've done this in a variety of ways, everything from an e-commerce site way back in the 90s, maybe even before Amazon was around, to retail spaces that were sort of innovative hubs of creativity where folks could come and like learn about our upcoming list, share ideas about books that they might be interested or think that we should create. Reaching out to educators, librarians, nonprofits, always our people from the very beginning. And now we are based in West Concord, Massachusetts, and we have a wonderful space that we open up to the community for events, fundraisers. Folks can come in and shop our shelves. So always, always trying to just be a part of the world around us. We've got some impressive numbers under our belts here and some great examples of how we've innovated in the, sort of the World Wide Web, everything from a YouTube channel that has had over 500 million views amongst our over 600,000 subscribers. That's mostly driven by our very successful sing-along series of songs that are animated and just a wonderful interactive way to learn some concepts. We've created an app of all things based on our Atlas book that's become a bestseller on the Apple Store. I'm pretty sure we're well over 1,500 unique titles published. I bet we're closing in on 2,000 now. And that includes books across currently 9 languages, although we're adding 2 more in the fall. And yes, probably a little bit higher than 35 million books total that we've shared with children all over the world. When remain an independent publisher, independently owned and run, you get people wanting to talk to you. So every so often we hear from the Times or Forbes, Publishers Weekly, kind of curious about what we're up to now. And we're up to a lot, but and a lot of what we do remains focused on nonprofit organizations, literacy organizations. From the very beginning, we've believed that all children deserve to see themselves in books. We believe that all children are interested in stories from around the world, from different traditions and cultures, and that's what these wonderful organizations, including Reach Out and Read, have helped support throughout the years. And we're always just so grateful for when our books become a part of your programs. We publish across many different disciplines. These are really what we call our core publishing tenets. What drives Barefoot from the get-go? We publish for ages 0 to 12. Our sweet spot is 0 to about 8 years old. We have plenty of books in the 0 to 5s range. And we do it all. We teach early concepts, ABCs, 1, 2, 3s, early social emotional learning. We like to build empathy and resilience through our books. And that's not just for the world around us and others, but for ourselves. And I think that's continues to be very important as we come out of the pandemic and as kids continue to try to navigate this world around them. We focus very much on bringing authentic experiences through our books. We work with authors and illustrators from all cultures and backgrounds, and have always striven to have a diverse array of children, families, community members in our books. We work with sensitivity consultants, so we're never misrepresenting a tradition or an ability. And we love the sciences too. Sciences are diverse. We have many interactive titles in this line, so kids can really sort of have a tangible experience with the content of our books. They can learn everything from biomimicry to interoception. These are concepts I had no idea about until about 2 years ago when we started developing these books. And then, of course, wellness in body, mind, spirit. And we do this through stories about building resilience and courage, embracing your emotions, and also a wonderful line of mindfulness books, even some yoga books in there. It's all connected, people. But I want to keep cantering along. So we created a wonderful collection for you all. This was curated in every title in the extremely hefty print catalog we created, approved by Reach Out and Read. All of the titles are beautifully illustrated and written. They are full size. I was talking with another organization earlier this week, and she called it Dignity Through Quality. And so the books, when you place an order for our books, they're going to be the same kinds of books that show up in retail stores, bookstores, libraries, schools, because we also believe all children should get the same high quality books, no matter who or where they are. Already mentioned our bilinguals. Of course, we have that wonderful those ongoing offers that you're so used to seeing with the other approved vendors. Competitive pricing, free shipping in the continental US. We've got it all. We've got it all. This is the catalog. I did just want to quickly show you a couple of the interiors. We have a wonderful table. If you haven't seen this already, and I will mention that we are happy to send copies of catalogs to anyone who may need them. It's a great resource. Mine is worn out. I've used it so much. But we have a wonderful table of contents where you can see we've created color codings for age ranges. We have icons. So if you're looking for bilingual titles, if you're looking for which titles have audio, you can find them easily. We even color coded the milestones chart for Reach Out and Read. And we have nice little call outs throughout our catalog that refers back to that wellness chart. And of course, some nice back cover information that you're probably also accustomed to seeing with other of the book vendors, but just how to order our books and some wonderful information about Reach Out and Read as well. Super quick, just some nice imagery of some of the bundles we put together. We've created quite a few for you, about 90 so far. And we do this because we know you all are busy. You might want to just purchase books all day, but we know you probably don't. So we've created these bundles in case you just need to quickly, fill your color bins or get some more books for those wonderful bookmarks. You can also shop individual titles as well. We know some people like to do that too. But this is just a few of the bundles we've created. We, of course, have anyone who serves children from birth. We have the collection for 0 to 6 months. We have some great formats, you guys. We have books for belly time, tummy time now, just released a few months ago. These are accordion books that sit upright, double-sided, fantastic mirror at the end. I highly recommend you just carry the book around with you if you need a mirror. And we have our baby proofs, which are these non-toxic, rip-proof, chew-proof, can be washed, sanitized. They're also recyclable and really amazing content on the inside too. And many also have audio with them. The bilinguals I've already mentioned. We have 9 languages now. We're releasing 2 more in the fall, Korean and Tagalog, more to come. Always please, if you need a language, if you need a book that has a particular that's story content, we love feedback. We love it all. So please let us know. Let us know what you need, and we will try to support you. And just a few more bundles before we get to the website. Our sing-alongs, I've already mentioned, hugely popular collection of ours. We put popular concepts to songs. Sometimes they're familiar, like Head, Shoulders, Knees, and Toes, or Wheels on the Bus. Sometimes they're new, like the Animal Boogie, which was our very first sing-along, or Boogie in the Bronx, or Everybody Move, which just came out a few months ago and all about kids of different abilities, celebrating how they get around in a given day. And of course, storybooks, humorous books, great ways, gentle ways to bring some important messages to the kiddos and their caregivers. But okay, let's go to the website because it's really cool. And I'm not sure how many of you had a chance to visit the website. And if you have, great. And again, love all feedback. If you haven't, this is going to be your introduction. It's incredibly colorful because that's what Barefoot Books is. And it's incredibly hardworking and we think easy to navigate. I've already pre-populated, I got to move my little Zoom icon here so I can see what you're doing. Already pre-populated the basket with a few things because I know we have a time, got to be aware of time, but I did want to just show you how easy it is to order. So when you come here, this is the landing page. You already see the wonderful offer. We really try to prioritize those bundles for you all, but there's many different ways to order. You can go by age, you can go by theme, you can always access the catalog. We have a little FAQ at the bottom. Important thing to note, you got to go through my ROR to get to the ROR version of our website. If you just go to our regular website, you're going to get sticker shock because it's our regular pricing. So this is the only way you can get access to your special pricing. But send your friends to our regular website. Tell them to go buy some Barefoot books. But anyway, so I'm going to just we're going to click on an all ages core bundle. This is a fantastic bundle if you're looking for your need to fulfill your need 6 months to 5 years. It's 25 unique titles, 10 copies each. So you get 250 books for $650. You're always going to see what your price is. You're always going to see the inventory level. And then if you're just, hey, I want to know what I'm getting, you can click here and you can click on the image and then see what the books look like. I love this one because you get to see the mirror, but you can really just get a visual sense of the books. If you want to read more about the books, you can do that too. That's what this column along the left with all the titles are. You just click on a title, it'll bring you to that title. You get to, again, if you want to purchase individual titles, you will always know the inventory, but you can read about the book. You can see other titles that are recommended that are like that book. All different ways to order from Barefoot. But I'm going to go back and I'm going to place another one of these in my basket. And I'm going to be patient and let it add before I move on. And then I'm going to also just want to quickly show you other ways you can shop when you're on our site. You can click on books. You can click on our little pull down menu here. But I clicked on bundles and you can just start to see like we have a lot of bundles. But we also have this wonderful filtering menu. So you can get as specific as you want. You can click on age and pull it down. You can choose your specific language. I'm actually going to pop up here and I'm going to go to Barefoot Bilinguals. And maybe I'm looking for a specific language. Maybe I'm looking for Haitian Creole. So I'm going to scroll down and find my Haitian Creole. Maybe I just need the books for ages 3 to 5. And it's the same experience. You click on the bundle, you can look at the images of the books, you can look and, click on the titles to learn more. I'm going to add one of these to my basket because I'm really purchasing a lot of books today. Wait till you see. So I'm here and now I'm ready to check out. So I hit my checkout button. This is going to take us to our shopping cart in just a minute. I've ordered so many books that it's overwhelmed. So here we go. So this is so great because you're always going to know what you're buying. You're going to get a breakdown of the titles in those bundles that you've purchased. You're always going to get the subtotal price, the total price because you've ordered 3 copies here. There's your Haitian Creole. Over here, you're going to get a nice summary of all the books across all the bundles you've ordered, what the average price is, your total. You have 2 options at this point. If you want 10% discount, you can put ROR10 right here in the offer code and apply it. I like free books. So I qualify for so many free books. It's ridiculous now, but I've added already 3 each of English and Spanish bilingual bundle. So that's all already in there. And again, you have so many options here. You can update your quantities. You can remove um, really trying to make it as easy as possible for you all. I'm going to click on proceed to checkout. And I'm not going to order because if I do, goes to our warehouse and I get in a lot of trouble. So, so I'm not going to actually place an order, but I do want you to see as much of the process as I can show you. So here we have, they've already added a shipping address, but we have pre-populated everything. So once you log in by way of my ROR, any addresses that are tied to your account will show up here, and you can select any one you want to ship. If you need to add one, you can do that too. We have a new address. Always defaults to free shipping, and you get all of these wonderful breakdowns. Continue to payment and review. Might take a little minute here because I'm overwhelmed my shopping cart. There we go. So here's where you have options on how to pay. If you have a prepaid balance, you can apply it, which is great. We have the invoice is the option that's defaulted. If your system requires a PO number, you can enter one here. It'll show up on the invoices and statements that you will get from us. You can also pay by credit card. You click this link, you click this box so that you certify that you're authorized to use those funds. And then you hit place order and everything is automatic from there. It flows through to our warehouse. They pack the books. They ship out to you. You receive an order confirmation email. Once the books ship, you'll receive shipping confirmation with tracking and also the invoice. If you've opted to pay by invoice, will be sent to you that way as well. So I'm going to try to close out of this, go back to our deck because I want to show you another way to order that we created in response to Reach Out and Read, National, and way back when we first launched, they placed many different orders. So in order for a lot of different Reach Out and Reads to see our books for the first time, and we wanted to make it simple for them and for them to do that. So we created what we call the multi-site order form, and I'm going to click on this. So we can dip in here. And this is a way to place an order, a single order that needs to go to multiple different addresses, as opposed to placing an order for every shipping address that you need to have to get books. I've already logged in. And so once you log in, this is separate from our website, but you still come to it by way of MyRoar. Your billing account will show up. This is static. It cannot be changed. You can enter a PO purchase order number if you need to. Just click change PO number and enter a number like so. And that will again show up on any invoices and statements that we send you. And then you come down and you start ordering. There's a pull down menu, but you can always just type and it'll auto populate. I'm going to order for Concord, Massachusetts. And again, we have a pull down menu and you can choose who you want to send that order to. And then the fun begins. You get to select your products. You can always refer to the Reach Out and Read catalog if you need a reminder of what you want to order. And you can either play with the pull down menu or you can type in. Oh, it's taking a little while. Okay, so here we go. So we have all ages. Again, you get the same info as the website, your price, how many are available. I'm going to order 2 of these like so. And I'm going to add this to the cart. I'm just going to order 2 bundles for this particular site. And then it automatically brings you to the cart so you can see what you've done, what you've ordered, if all the information is correct. For the multi-site order form, we are only able to offer the 10% discount as opposed to the free book. So you will automatically get a 10% discount as long as you reach that minimum $100. And then this is the fun part. You get to duplicate the order. So if you have 10 different addresses and you need them all to get in all ages, just duplicate it 9 more times. It's great. And you get right back to the first page. And then you can choose another site. This time I'm gonna, I know these are all states. This is a demo site, but I'm choosing a different state for this process. I'm gonna have Derek Bookish get some books now. We've already got the duplicated order, so I could just say add order to cart, or I can add another item. So maybe, yes, I need Derek to get the all ages, but maybe Derek loves cats, and so he wants some Learn with Cleo, which I think Cleo, she will pop up, I believe. Here she is. So we're going to give Derek Bookish and his patients some Cleo titles, add that to the cart. And now you see that we've entered this order and you see it here. I'm done ordering. So now I'm going to go to my cart. And it's going to show you both orders that have now been placed. So you've got the first order here, just the all ages. Again, you've got those nice summary quantities and numbers there. And then you have the second order and the summary for that particular order. And then at the end, you get that grand total of books that you've ordered, the average price per book. And we are in the midst, for anyone who might require this, of creating a version of this website that can be submitted for approval before we process the order. So that's the button that you see here. But there is a button on the form of the order that, of the multi-site order form that doesn't require approval. This would just say submit order. And then it's all automatic. It goes to our website for fulfillment. You get lots of emails telling you you've placed the order, your summary. You'll get your shipping and invoice with tracking once the books ship. And we have a whole process that we're putting in place for approval as well that just adds a few more steps. But that's our fabulous and we think exciting multi-site order form. And I believe that's everything I have, yeah, in the presentation. So I'm going to stop sharing. And if I went too fast, I apologize. But sometimes I can talk too much and go over time. So I just wanted to make sure that I had enough time to get all of that wonderful information in for you all. Happy to send a copy of this deck, a PDF of this deck. If you have any questions, you can let me know or shoot Carrie an email and she can let me know. Again, happy to share any resources that might be of interest to you. And we're just really thrilled to be working with you all. Thank you.
Oh, thank you, Sarah. Thank you, Nancy. Like I said in the chat, a lot of these books will look familiar to you because we've been purchasing from Barefoot Books for years, and we will continue to do that in the future as well. So more of these books will be coming your way, as well as new books that Barefoot Books comes out with. But yes, we're providing 50% of your books for the majority of your sites, but there's another opportunity for you guys to provide 50% and purchase through Barefoot Books. And so there's more information on my ROR about everything that Sarah went over regarding how to log in and set that up. And we'll also send a couple one pagers in the follow-up email specifically about this. And we'll send Sarah's PDF version of the PowerPoint in the follow-up as well. And of course, like Sarah said, any questions, feel free to reach out to our team. We can answer them to the best of our ability, or we can connect you with the Barefoot Books team if you need any help. Well, thank you again. And we are going to transition quickly over here to Lakeshore. And we have John George with us, who's going to talk a little bit about some of the opportunities that we've been working on with Lakeshore. And I think John might be sharing his screen too. So make sure that you've got the ability to do that. But I'll pass it over to you, John.
Thank you so much, Carrie. It's a pleasure to be with you all this afternoon and grateful for the opportunity to kind of grow our partnership with Reach Out and Read. And also an honor following up the folks, Sarah and Nancy from Barefoot Books. I know we do carry your mindfulness activity cards on our site and in our stores. So very cool little full circle moment there. I'm not sure if y'all are familiar with Lakeshore. I'll give a brief overview of us here and share the screen. Um, but we are an education company first, and we specialize in professional grade toys, learning materials, pediatric furniture. We've been around since the 1950s and were founded by a single mother, Ethlyn Kaplan. Kind of the traditional American dream story. She moved to San Francisco and opened a toy store, but saw a lot of her customers were educators and teachers who had the need for teaching supplies. And over the years, that evolved from a singular toy store to outside of early childhood to elementary and high school materials and learning supplies and into furniture. And just in the last few years, we created a little healthcare division, which is where I come in. So I support all of our healthcare partnerships along the East Coast. I'm based in Pittsburgh, but I was briefly a New Yorker living in Astoria, Queens for some time. And every time I get up there, I tend to visit a lot of the health systems y'all are a part with. We work with NYU, NYC Health and Hospitals, a lot of the folks in their child life department or their behavioral health centers. So I'm sure some of y'all may have seen our materials or furniture throughout some of the hospitals there. But what we've done, we've been able to put together a few room templates if you're looking to elevate your waiting room and lobby environments to go along with the reading materials provided through Reach Out and Read. So you all will have access. Let me, if I can move this around here, get to the other page. Oh, just one second. Move that and move this. Okay, so you all will have access to a personalized website. We call it our ePro site, but this is for all participants in Reach Out and Read New York. So there will be a shared login. Everyone will be provided access to that. I believe sometime early next month, we'll have a messaging going out on how to access and an official launch for this. But we've created a few templates that may help just elevate the environment throughout the practices that you have. And there will be a shared login, and within this, it is kind of like if you think of Amazon Prime, essentially, or move that down here where you can see order history, you can get instant quotes, you can change the address books every time you go in there. It'll remove any old credit card or address information. You'll have the ability to upload that yourselves there within the address book for your specific location. And just as an example, there are 4 created kit options down here. So the first one, just a very basic, tables, chairs, and a little tree bookshelf that can be wall mounted to save some space. You'll see all the prices and the items listed out here. Now, these are templates that have everything kind of preloaded, but of course you can edit these quantities. So if you just need to have 2 chairs in there, simply change that there, and you'll go ahead and add items to the cart. Within the cart, you'll be able to view that there and then go on to add any payment information. Now, it isn't just limited to what is in these templates. Say you wanted to go ahead and get the items here in this first template, but then you maybe wanted to add some toys or something else, to elevate the environment. Something for, let's say, infant toddler, right? And we want to get a few of these specimen viewers, which are very fun. And I know I had these when I was in Head Start as a child. So just add those to the cart, and it'll go along with that pre-built template. So view cart here, um, and then go to checkout, and then you'll be prompted to enter in your specific information. There is the headquarters. This is just a standard Boston login up there, but you'll be able to change all of your address information, payment information, and then once you make that purchase, all of that clears out. So while it's a shared site, it'll still be individualized once each one of you log in there. And just to show a few more of the templates, that goes from the basic just tables, chairs, and a bookshelf, all the way up to if you really want to have a large project and add some lounge seating, our sensory viewer, which is fantastic, a rug in there, which I know carpets and rugs, depending on the environment, sometimes those aren't welcomed in a healthcare setting, just on the cleanliness side. But again, you can always just remove any items in here that you may not need. But if you like the overall view of how that room is and keep the bones of it there. So again, that's our option 4 there. And then there's a few smaller items as well to where you want to add some additional storage for some toys or materials or more books. Also, depending on the age range, like the tree is fantastic because the front of the book will show. So I know a lot of the younger learners will be more drawn to it if they can see the cover of the book. Whereas for maybe some of your older children in there, and if you have a lot more options available, kind of a standard bookshelf to stack them horizontally there. Um, so again, this I believe will be officially launching this in early to mid-April for you. Um, and I should add, all of the furniture is lifetime warranty, so I know children can be a bit rough on materials, right? And especially if there's any behavior challenges. These are meant to be legacy items. So if you buy a chair from us, we want you to buy that chair one time. If something were to break or crack, you just take a picture, you send it to me, and we just send you out a new one, no questions asked. So everything is designed, by educators with the intent of durability, safety, age appropriateness, and easy to clean, which is definitely a factor as well, of course, with the little ones. So and just again, just a little brief overview of what we're doing here. I know we've done this at Shop in Philadelphia. They have a similar setup where they have a few pre-built options that they're putting into their outpatient locations there. So grateful for the opportunity to be a resource for you all. And Carrie, I guess I'll defer to you in terms of when we'll kind of provide access to this for everyone in the coming weeks. But just wanted to get in front of you all and kind of share what we're doing here. And again, grateful for the opportunity to be a resource for Reach Out and Read.
Thank you, John. Yeah, in sneak preview of what we will be officially launching in April with the logins and opportunities there. And yeah, we're hopeful to get some more grants to be able to fund this. And we know that sites have funding as well to be able to support waiting room enhancements. We've also been partnering with New York Public Library, who has used Lakeshore for a lot of these waiting rooms, and lots of excitement in the chat also. And notes there about some of the waiting room transformations that we've done. So thank you, Lakeshore. Thank you, Barefoot Books. And thank you, everyone, for joining us today. Again, we'll follow up with an email early next week with follow-ups and with lots of information and lots of links to the different resources that we mentioned today. As always, if you have any questions about anything that we mentioned today or questions in general, feel free to reach out to our team and we're happy to respond. This will be available on our YouTube page, and we'll also send the recording in the follow-up email as well. Anything else, Jesse?
No, thank you all so much for a wonderful town hall. And once again, any questions, please reach out to the team and have an amazing weekend. Take care all.
Thank you so much.
Thank you, Gabriella.